The study was a very interesting study because it's addressing a very relevant clinical question for practice, because at the moment the standard of care for the treatment of small cell lung cancer in extensive stage is the combination of chemotherapy and immunotherapy. However, it is considered standard also to give consolidation radiotherapy on the chest for those patients that respond well to the treatment. However, in the studies that confirm the role of chemoimmunotherapy, there was no place for chest irradiation. So actually we do not know whether chest irradiation can be given together with chemo-IO. So this study addressed the question of whether chest irradiation can be given to these patients. It's a randomized study where patients that got chemo-IO first line during the maintenance immunotherapy phase were randomized between having chest irradiation or nothing. And the problem was that after approximately 60 patients enrolled, there was a signal of an excessive toxicity, especially toxic death, in the group of patients treated with chest irradiation. So there were 5 cases of toxic death due to sepsis. 4 out of 5 were due to sepsis in this group, as compared to only 1 case in the control arm. So the accrual was stopped, and there was a assessment of those cases, and in fact it's not possible to make a final conclusion as to whether there is a connection between chest irradiation immunotherapy and those toxicities. However, for safety concern, the study was closed and accrual was stopped, and so actually at the moment we don't have clear evidence that there is a correlation between those events and radiation immunotherapy. However, there is a warning for doctors, clinicians to deliver chest irradiation in these patients, so we need to be very careful in selecting the optimal patients with small tumor volume and using sort of radiotherapy which is not too aggressive, so like IMRT on a small volume. Otherwise, there is probably some risk of excessive toxicity in these patients.